Welcome back. Testing and tracing, tracing and testing. The two T's here, going to hear them a lot. It's what we keep saying needs to be happening for safe and confident reopenings across the country, whether you walk into a store or a school campus. And experts agree that communities need to ramp up both. Joining me now, Dr. Joya Mukherjee is the Chief Medical Officer for Partners in Health, which has launched a new initiative to support state and local governments as they implement their own contact tracing program. And we also have Nassau County Executive Laura Curran. Nassau County is looking to hire hundreds of contact tracers. Local officials are working with New York State, which is partnered with Johns Hopkins Bloomberg School of Public Health to do just that. But we wanted to give sort of a national and sort of a on-the-ground perspective here. Dr. Mukherjee, let me start with you on sort of explain what you're trying to do and how much of this should you be doing, and should this be, are you filling a role that the federal government ought to be filling?
Yes, we are filling a role that the federal government ought to be doing. Partners in Health is a medical charity that works mostly in countries in Africa, Latin America, and the Caribbean. And as such, we have often done contact tracing for diseases from Ebola to cholera to HIV. And we often were working side by side with the Centers for Disease Control on these efforts in other countries. But unfortunately, for 40 years, the public health infrastructure in the U.S. has been progressively weakened. And so we found ourselves with excellent hospitals and nurses, medical staff, but kind of passively waiting for sick people to roll in and then to take care of them. And there are public health measures that need to simultaneously be taking place to stop the community spread of the virus. It's only about 20% of all people with coronavirus who will need to be hospitalized, and the other 80% are just going about their daily business mildly or even pre-symptomatically. And so unless you figure out who those people are and help them quarantine safely before they spread the disease, there's no way to control the epidemic.
Laura Curran, you're trying to obviously figure out if you've met the guidelines to reopen in your county. You're close. What's missing?
Well, we have 7 metrics that we have to meet. We had 5. Today, unfortunately, we're down to 4. It's Nassau County and Suffolk County together as one region on Long Island, so we have to meet those together. And one of those that we're expected to meet is contact tracing. So our health department, we're a suburban county population of about 1.4 million. We have an excellent award-winning health department that already has a solid team of contact tracers. So when we got our first case of COVID-19 on March 5th, they jumped into action and they traced the person's contact, reached out to everyone who may have been exposed. And this was a way I think we really contained it as much as we possibly could. We're really right in the epicenter here. We're just east of New York City.
Right.
Yes.
Do you, Laura Curran, do you have a quarantine? So what would be your quarantine plan going forward after you reopen? Do you have hotels set aside, or are you working with a university? Where would you quarantine people that you find in the contact tracing process?
People are generally isolating at home. That's how it's been. We were using hotels at the very beginning when travelers were coming from overseas, but right now it's working at home. We have an excellent healthcare system here, and we will find, of course, as society does begin to open up, the whole point of flattening the curve was to slow the spread. So when we begin to open up again, we expect to see perhaps a little bit more infection happening. We want to control that, slow it down, so that we can open in a safe way.
Dr. Mukherjee, some of us envision that the federal government would come out and say we need 300 of an Army Health Corps, basically 300,000 contact tracers. That's the number we've seen, anywhere from 100 to 300,000. But tell us, what are you looking for in a contact tracer, and how much of a jobs program could this be?
Yeah, well, first of all, I want to commend what Ms. Curran is saying and what Nassau County is doing, because the real lift is local. And in my experience for 25 years as an infectious disease doctor and a public health specialist, all epidemics are very local. So yes, we need federal money and federal support, but departments of public health all over the country do know how to do this. They're experienced professionals. This is their job. But the size and scale and speed of this epidemic has made them need a lot of help and additional hands to control this thing. So I think you can still have a very localized response and have federal support for that. And we've seen that in epidemics around the world. And that's a very important thing, to have local control. In Massachusetts, where we are supporting the public sector, there are 351 local boards of health, and they're excellent. And we work to support their work, because at the end of the day, this is something that should be done by departments of public health, and they want to do it by and large.
Laura Curran, how many the contact tracers does your plan to hire these folks locally?
Yes, working with the state, working with the Bloomberg Foundation, they're doing the hiring. There's a curriculum, an online curriculum that they can follow, and then a test that they take. And so we're going to make sure that even though we have a team of very experienced contact tracers, that they do the curriculum as well. So everyone is playing by the same set of rules. Everyone's sort of speaking the same language.
Yeah, no, Dr. Mukherjee, what you just said about having it to be almost hired locally, that makes a lot of sense. People respond to members of their own community. If members of their own community are the contact tracers, that makes a lot of sense to me anyway. Dr. Mukherjee, Laura Curran, I am unfortunately out of time, but thank you both for sharing your experiences and expertise with us tonight.